Bilevel positive airway pressure, also known as BiPAP, is a form of non-invasive positive pressure ventilation. In BiPAP therapy, two levels of positive pressure are delivered, one during inspiration to keep the airway open as the patient inhales, and the other lower pressure during expiration to reduce the work of exhalation. BiPAP is delivered through a tight-fitting mask that fits over either the patient's nose or the mouth and nose. BiPAP is typically used in the treatment of patients with chronic respiratory failure.
This is a BiPAP biphasic ventilator. Typically, the paramedic will find a patient on a BiPAP machine, either in a nursing home or at home on a sleep apnea type machine, which will have a prescribed BiPAP. When you get there, the patient could be on two different types of masks. Typically, you'll find them at home or in a nursing home on a nasal mask. And this nasal mask goes on just like this. If they're not on a nasal mask, they'll be on a complete face mask, just like this, with head straps in place. The BiPAP machine has IPAP and EPAP, whereas different than CPAP. BiPAP is set in two different phases. You have the inspiratory phase and the expiratory phase. On this monitor, if you look, you have EPAP, and that's very similar to CPAP, except when the patient initiates a breath, the machine will trigger a positive pressure breath till it triggers a pressure release at 15. These machines are used for patients in mild respiratory failure that don't require intubation. This is a non-invasive tool used to assist patients with ventilatory support as well as oxygenation. We do not have a unit small enough at this time to be used in the pre-hospital setting, and you're going to have to make a decision how you're going to get the patient from the place that you're at now, the facility or their home, to the hospital, the receiving facility.